So esophageal cancers and stomach cancers form the majority of upper GI cancers. So in both stomach and esophageal cancer, radiation therapy forms an important treatment. It is either given before surgery along with chemotherapy, or it can be given after surgery. Sometimes in whom surgery cannot be performed, it is given as the only treatment. So most commonly in esophageal cancers, radiation therapy is given first, then surgery is done. In stomach cancer, surgery is usually the first treatment, and after which radiation therapy is given. So there are almost in every stage and every type of esophageal and stomach cancers, radiation therapy plays a significant role. Now, coming to how is it given, generally the same CT simulation scan is done. In one special thing about upper GI cancers is that whenever the CT is done, sometimes oral contrast is also oral barium is also given if indicated, so that the structures and the tumor is better visualized on the CT scan. So once on the CT scan, then the tumor and the surrounding areas which should get the radiation is marked out, and the surrounding critical structures such as the heart, the lung, the liver, the spleen, the spinal cord, etc., are marked out. Because this esophageal one thing is that we have to treat a longer area, whatever tumor is there, a little bit more than that also we have to treat. And stomach also has critical structures like liver beside it, spleen beside it, the spinal cord in the behind, lung atop of it. So these areas are critical structures that need to be taken care of. So, what technique is best for esophageal and gastric cancers? IMRT is the preferred method, IMRT or VMAT. That is the preferred method of treatment, because we have to be careful about the surrounding structures also. So, the tumor should get the highest dose, whereas the surrounding structures should get very, very minimal dose. And generally the duration, it may vary anywhere between 25 to 28 days. So generally around 5 to 6 weeks of radiation therapy is given for esophageal or stomach cancers. Chemotherapy is sometimes given along with radiation concurrently. Sometimes tablets are given, oral chemotherapy tablets are given. That depends on the type of tumors and the stage of tumors. Coming to the side effect profile of these cancers, so mainly it involves acute, that is early side effects, and late side effects. So early, because we are treating the esophagus and the stomach, there can be some amount of nausea, vomiting, gastritis can be there. The patient may have some amount of vomiting. So even because we are treating esophageal area, he may have some difficulty in swallowing, that is temporarily. Another side effect is that when you're treating esophagus, surrounding there is lung and mediastinum, so he may have sometimes some amount of cough and infection. So, in the longer run, again, because lung is there, the heart is very close by, they can have some long-term side effects, such as the lung can get a little bit of fibrosis that can develop in the long term. Some heart abnormalities can occur, but that is again very, very rare. Coming to the stomach cancers, also the side effect profile is similar. Again, it can have some liver toxicities, and sometimes because the spleen is very near, that can lead to some amount of reduction in the blood count. Apart from that, the radiation therapy to stomach and esophagus is generally very well tolerated. It is given mainly for around 6 weeks, because within that time the patient is generally tolerates the radiation therapy very, very well. So that is about radiation therapy in upper GI cancers.